Neurosurgery is not a job. It's a vocation and it's a calling.
In the moment, in the minute, it can be, seconds to life and death.
It's neurosurgery internship. Like, there's lots of things to do, but I never felt alone.
We are all trying to figure things out together. It's one of the most powerful ways to be educated and to enjoy your training here at Northwell.
My name is Michael Schulder. I'm the Vice Chair and Program Director in the Department of Neurosurgery at Northwell Health. We have a department that cuts across the entire health system.
Northwell is one of the largest neurosurgery programs in the world. Part of that is because we have a large geographic footprint, and part of that is because we've created a network of excellent hospitals that basically all work under one system.
The most attractive thing about Northwell is its size.
It is the largest health system in the state of New York.
Our residency training program is focused at 3 sites: North Shore University Hospital and LIJ Medical Center, which are 1.8 miles away from each other. Lenox Hill is a relatively short drive away in Manhattan.
We're able to provide patient care to a breadth of patients with unique backgrounds, unique pathologies that really afford our trainees the opportunity to go and work literally anywhere.
There's no question that the greatest strength of the Northwell Neurosurgery program is the clinical volume. Based upon that clinical volume, we can do many other things.
Northwell has a huge network of neurosurgeons, and I think that part of the advantages is that you can kind of pick attributes from different ones or different things that help build you into the neurosurgeon you want to be. The culture at Northwell is, I think, a major draw.
The focus of our program is not to overly burden the residents or to make them feel like they cannot keep up with the workload, because our main goal is resident education, and a lot of that comes through doing the clinical work. We like to get residents into the operating room pretty much from the beginning of their training.
I think it's extremely unique how much the interns get to operate, and that's mostly OR procedures.
Every month, we have a dedicated resident wellness and academic day where we work in the BioSkills Education Center in Lake Success, and also have an opportunity to review current topics and the latest and greatest in surgical techniques.
Our angio suites are also connected to the BioSkills lab, so that way you can see cases going on live as if you were right in the control room of the angio suite.
All the latest, greatest things are brought to bear here, whether it's focused ultrasound or lit, laser interstitial thermal therapy, or depth electrodes using a robot.
If you graduate from this program, you will absolutely know how to do pretty much every kind of technical neurosurgery and do it well.
You have the ability to choose what you want to go into. And that's not something that's necessarily for everyone. It takes someone who has some passion and some drive.
So I discovered in my 3rd year when I was over at Cohen Children's Hospital that I loved working with kids. Being able to discover your passions early on, say as a PGY 1, 2, or 3, and then focus those in as you become more senior is incredible, and I think a lot of places don't have that kind of flexibility.
We are trained to be excellent surgeons first, and then we get to kind of pursue our other passions, whether it be in basic science research, clinical research, or even global health.
I think the special opportunities that are afforded to the residents are multiple. First of all, there is a built-in 2-year portion of the residency that the residents can choose to do whatever they want to do.
Residents are often the ones who have the best ideas. Believe it or not, they are the ones who tell the field where to go because they ask great questions. Research is the chance for residents to answer those questions.
That was a big draw for me. There aren't that many programs left in neurosurgery that still offer those 2 full years with protected time for research.
We also have the option on our on-site research institute, the Feinstein Institute for Medical Research, for residents to get a PhD.
We also have Cold Spring Harbor, and so our ability for our residents to perform really high-quality bench research, both basic science as well as more translational research, is really unparalleled.
The amount of resources available to help you with your research goals, even from a clinical standpoint, all of our attendings have research projects going on. So when you discover, oh, this is something that I'm interested in doing or pursuing as far as a subspecialty, and you find mentors in those fields, they're gonna have projects that you can jump on and help them with. That's a real strength of this program.
In our department, mentorship is a key factor in the residency experience.
A resident should select this program because they want to be amongst the best.
Everyone here is very engaged with the residents. It's really a resident-centric program.
The benefit for our residents is a varied experience where not only do you have the support and camaraderie of having many other residents that you work with, but also the opportunity to be first assist at the elbow of the surgeon in all of our clinical sites here in Manhattan as well as in Long Island.
I mean, it's hard work. There's no way around it. You can't learn to be a technically excellent neurosurgeon without working hard. But having said that, compared to a generation or two ago, this does not have to come at the cost of your life or your mental health.
The program does so many things for the residents to make sure that there is a work-life balance and to respect the needs of the residents and make sure that those needs are met beyond just the clinical learning needs and the research needs.
Residents have the ability when they come here to really live the life that they want to. They can live in a large metropolis, they can live in the suburbs, and they have the ability, based on where we are, to be able to get these areas easily.
When you have New York in the mix, it sets it apart from everywhere else. You can live, in a home in Long Island, or you can live in an apartment in Astoria, Queens, or even in Manhattan.
Commuting here has been very, very easy. I live in Murray Hill. It takes me about 20 minutes to get back and forth each way. I drive both ways.
I live in Queens, Forest Hills, which I honestly feel like is the best of both worlds. I can have a short subway ride to the city, or commuting to the hospital is really easy. It's like a 15-minute drive. I think it's the perfect balance.
In the Northwell Neurosurgery Department, what we are looking for primarily are applicants who want to leave neurosurgery better than they found it.
I think to an ambitious person who wants to be amongst the best and be exposed to the best, this is the place.
We maintain a spirit of inquiry in our department. We always want the residents to be thinking, what can we learn from this experience? What can we contribute to the world's knowledge about neurosurgery?
Teaching residents and students is my greatest passion, helping to influence the next generation of thinkers and leaders across the world.
Being a neurosurgeon has given me some of the most meaningful experiences in my life because you have the ability to so profoundly impact another human's life.
A big thing about deciding where you want to go to residency is where you fit in and where you find your people, and I really found my people here. Dr. Shoulder in particular was, arguably one of the reasons I went into neurosurgery, how much he cares about his patients and how much he works with the residents to inspire them to sort of be the best versions of themselves. And I think that this program really sets you up to do that.
You go in, you put the work in, you expose yourself to this environment, you get great training, and then the rest is up to you.